So as a part of the INI CET revision series, in the today's discussion, I will discuss the localization of cranial nerve lesions. So I'll give you the various clinical scenarios. Depending upon the clinical scenario, you should be able to pick up which cranial nerve is having the damage. So 5 clinical scenarios are there. So this is the first clinical scenario. That is, a 55-year-old man presents with unilateral weakness, and the individual is also having wasting and as well as the fasciculations of the tongue. On examination, the tongue deviates to the left on protrusion. So which cranial nerve is having the lesion in this patient with the following clinical examination? The options are like 5th, 7th, 8th, 9th nerve lesion, right 12th nerve lesion, left 12th nerve lesion, right 11th nerve lesion, 9th nerve lesion, 4, 5, 7 nerve lesions, 5th nerve lesion, or left 11th nerve lesion, 5, 7, 8 lesion, or is it 9th and 10th lesion, or is it like 6th nerve lesion or 4th nerve lesion? So you take the tongue. Tongue is supplied, the motor supply to the tongue is by 12th nerve. The individual is having the wasting and as well as the fasciculations and unilateral weakness, and the tongue deviates to the left on protrusion. Remember, in case of the 12th nerve examination, which is nothing but your hypoglossal nerve, so how is that you need to examine is, first you need to look for, is there any deviation of the protruded tongue, right? You need to ask the individual to protrude the tongue and you need to look for any deviation is there. For suppose, if the tongue is deviating to the left side, then, right, when the tongue is deviating to the left side, then left 12th nerve lesion is present. Okay, left 12th nerve lesion is being present. So among the options which has been given to you, the answer is C, that is left 12th nerve lesion. And what about the other abnormalities within the tongue that you can look for? So you need to look for any deviation of the protruded tongue, and you also need to look for if there is any abnormal movements of the tongue, that is flicking in and out movement. Like where can you have that? You can have that in patients with the chorea. And third important thing is you need to assess the strength of each half of the tongue. So how will you assess the strength of each half of the tongue is by asking the patient to push against the examiner's finger, which is kept over the cheek with his tongue. That is how you can assess the strength of each half of the tongue. And over the tongue, you also need to look for if there is any wasting, any tremors, or any fasciculations or fibrillations. For suppose, if the individual is having any wasting, tremors, or fasciculations or fibrillations, this tells you it is lower motor neuron type of the 12th nerve paralysis. Now, how will you differentiate the lower motor neuron and as well as upper motor neuron paralysis of the 12th nerve? In lower motor neuron paralysis of the 12th nerve, the wasting is present, whereas upper motor neuron, there is no true wasting. And in lower motor neuron paralysis, the fibrillations may be seen, whereas upper motor neuron lesion, there is no fibrillations. And LMN palsy, protrusion of the tongue is possible and the tongue deviates to the affected side. And the protrusion of the tongue is very difficult in case of the UMN palsy. Flaccid paralysis will be there in case of LMN palsy. Small and spastic paralysis will be there in case of the UMN palsy. Jaw jerk is normal in case of LMN palsy. Jaw jerk is exaggerated if it is bilateral UMN palsy of the 12th nerve. So this is how you will be able to differentiate the LMN and as well as the UMN palsy. So the clinical scenario which has been given to you was the left 12th nerve lesion. Now you take the next, that is second clinical scenario. A 44-year-old man presents with progressive perceptive deafness, vertigo, unilateral facial weakness and loss of sensation on that side of the face, and imaging reveals the presence of cerebellopontine tumors. So the individual is having deafness and as well as vertigo. That means which cranial nerve has gone? That is vestibulocochlear nerve, which is nothing but your 7th cranial nerve is damaged, right? The 7th cranial nerve, sorry, 8th cranial nerve is being damaged, okay? And the next options are, the next examination findings are unilateral facial weakness and loss of sensation on that side of the face. So you take the sensory sensations. The sensory sensations of the tongue is by your 5th nerve, and the facial weakness, if it is there, then it tells you either the 5th nerve weakness or even the 7th cranial nerve weakness. Now let me discuss about them in detail. So you take the 5th nerve first, that is trigeminal nerve. It is a mixed nerve. It has the sensory component, right, and it has a motor component. Sensory component, it is supplied by ophthalmic, maxillary and as well as mandibular. So ophthalmic, maxillary, mandibular, they bring the sensory sensations from these particular divisions of the face which I have given you within the image. And what is the motor supply of your trigeminal nerve? They supply the muscles of mastication, that is medial and lateral pterygoid, masseter and as well as the temporalis. So these are the motor supply to the tongue, right? So this is about the motor supply to the tongue. So when there is trigeminal nerve palsy, these muscles of mastication undergo weakness and thereby the mastication does not occur within the individual properly. Then coming to the examination of the trigeminal nerve, right? You need to do the sensory sensations by the wisp of cotton, or the sensory sensations can be tested by the test tube, that is temperature sensations. One is your cold and the other one is the hot test tube. And what are the reflexes which are being carried by your trigeminal nerve? One is your corneal reflex, jaw jerk and as well as the blink reflex. All these reflexes, they are being carried by your 5th nerve, and along with that even 7th nerve also helps. Now coming to your facial nerve examination. Facial nerve, apart from muscles of mastication, it will supply all other muscles which are required for the movement of the face. Like for example, you take you take for the wrinkling of the forehead. For wrinkling of the forehead, the muscle which is required is the occipitofrontalis, which is supplied by your facial nerve. And second is like closing the eyes tightly. So to test this, the muscle which is required is orbicularis oculi, which is supplied by your facial nerve. And next, to blow your cheeks, right? To blow your cheeks, right? You require buccinator, which is also supplied by your facial nerve. And to blow the whistle, the muscle which is required is orbicularis oris. And this is also being supplied by your 7th nerve. Okay, this is also being supplied by your 7th nerve. So once the facial nerve is paralyzed, so all these muscles are paralyzed, so there will be weakness of your facial muscles. And the reflexes which are being carried by your facial nerve is, one is your conjunctival and corneal reflex. So actually the afferent will be the 5th nerve and efferent will be 7th nerve for these corneal and as well as conjunctival reflexes. And what are the sensory sensations of your facial nerve? That is mainly the taste sensation. So we have a branch of the facial nerve, that is chorda tympani. So chorda tympani, it supplies anterior 2/3 of the tongue, right? It supplies anterior 2/3 of the tongue. And it also has a secretory function. Which one? The facial nerve. Secretory function include lacrimation, nasolacrimal reflex and as well as the salivation. So this is about your 7th nerve. And the next is the vestibulocochlear, that is your 8th nerve. It has vestibular component and cochlear component. Vestibular component is the one which is required for your the balance, and the cochlear component is the one which is required for the hearing process. So for hearing, what are the tests that you will do is Rennie's test, Schwaba's test and as well as the Weber's test. And remember the basic principle for all these tests, air conduction is more than compared to that of the bone conduction. And the tuning fork that we use here is the 512 hertz tuning fork is what we use. So in the clinical scenario which has been given to you, there is deafness and as well as vertigo. So your eighth nerve is gone. Sensations over the face are being lost. So fifth nerve is gone. And there is facial weakness. So your fifth and as well as the seventh nerve is gone. So what is the answer to the second clinical scenario? The answer is fifth, seventh, eighth nerve lesion is there. Now let me take up the third important clinical scenario. So third important clinical scenario is a patient complains of hoarse voice, difficulty in swallowing, choking when drinking the fluids. Examination reveals visible weakness of elevation of the palate, depression of the palatal sensation and loss of gag reflex. So now the cranial nerves which are being damaged here, let me tell you, that is 9th and as well as 10th. So how is that you are able to tell 9th and 10th, that is glossopharyngeal and as well as vagus is gone, is 9th and 10th, they carry the sensory sensations from the posterior part of the tongue. That is not mentioned here. But gag reflex, the afferent for the gag reflex is 9th and efferent for the gag reflex is 10th. And the 10th nerve particularly, it supplies the laryngeal muscles and it also supplies the palatal muscles. So the individual is having weakness of elevation of the palate and depression of the palate. So your 10th nerve is gone. And your laryngeal muscles, once they are weak, the individual will have hoarseness of voice. The individual will have hoarseness of voice. And the individual is also having difficulty in swallowing and choking when drinking the fluid. That means your 9th nerve and as well as the 10th nerve is damaged. For swallowing, you require both 9th and as well as 10th nerve. So the answer to this particular third clinical scenario is your 9th and 10th nerve lesions are there in this patient. Okay. Now let me discuss the fourth important clinical scenario. So fourth important clinical scenario is a 28-year-old man presents after surgery with inability to rotate the head to the right and to shrug the left shoulder. Now for rotating the head towards the right, you require left sternocleidomastoid, and the individual is also having difficulty in shrugging the shoulders of the left side. So you require left trapezius. Right, you require left trapezius. So this left sternocleidomastoid and as well as the left trapezius. So these two muscles are being supplied by your left side spinal accessory, which is nothing but your 11th cranial nerve. Okay. So now what is the answer in this question? So in the fourth clinical scenario, the answer is among the options given to you, left 11th nerve lesion, which is nothing but your spinal accessory. So how do you test that? Let me just show you. So now in the clinical, in the image which has been shown to you, the individual has turned the face towards the left side. So for which he require the right sternocleidomastoid muscle. Okay. So, but in the clinical scenario which has been given to us, the individual was having difficulty in weakness in turning the head towards the right side. So for which left sternocleidomastoid is required. And this is how you need to test for shrugging of the shoulder. Now whenever there is unilateral paralysis of the trapezius, what will be the features? The individual will have winging of the scapula. Right, the individual will have winging of the scapula. Okay, so once your 11th nerve is damaged, the individual cannot shrug the shoulders, and that will be responsible for the drooping of the shoulders on the affected side. So in the clinical scenario which has been given to you, the answer is the left 11th nerve lesion. Okay, next then you take the fifth clinical scenario. Which cranial nerve lesion is responsible for signs and symptoms which has been described below? The clinical scenario is a 35-year-old woman with multiple sclerosis complains of diplopia. Examination reveals inability to abduct the pupil on one side. Okay, so in multiple sclerosis, the most common cranial nerve which is being affected is the second cranial nerve. But our patient is having difficulty or inability to abduct the pupil on the one side. Now, for abducting the pupil, the cranial nerve which is required is the abducens. Right, the cranial nerve which is required is the abducens. So, abducens, which is nothing but your sixth nerve. So, what will be the answer in this question now? The answer is K. That will be the sixth nerve lesion. Now, let me tell you or let me discuss like why sixth nerve is getting affected in multiple sclerosis. In multiple sclerosis, there will be demyelination, right? Demyelination of the structure which is connecting 3, 4, 6. And in this process, the sixth nerve can also be affected. Now, you take 3, 4, 6. It supplies all these extraocular muscles. And everyone is aware of this formula, SO4, LR6, remaining 3. SO4 is your superior oblique. When superior oblique is gone, depression, abduction, intorsion is gone. When LR6, when lateral rectus is gone, only abduction is lost, and because of which the individual can have diplopia. Whereas remaining 3, superior rectus, medial rectus, inferior oblique, all these are supplied by your third cranial nerve. So please remember now, very, very important point. Once your lateral rectus is gone, the abduction is lost. Okay. So the answer in this question is the sixth nerve lesion. So to summarize all the clinical scenarios, the first clinical scenario was related to the tongue. So that is 12th cranial nerve is gone. The second clinical scenario was related to deafness and as well as vertigo, that is 8th nerve. Facial weakness, that is your 7th nerve. Sensory sensations on the face, that is 5th nerve is lost. So 5, 7, 8 lost. Then hoarseness of voice and difficulty in swallowing, 9th and 10th nerve is lost. Inability to rotate the head and as well as shrug the shoulders, that is your 11th nerve, and that too on the left side. And abducting the pupil to one side. So here the 6th nerve is lost. So this is a quick summary of the cranial nerve lesions. So if you have liked this particular video, please mention in the comment section, and you also mention in the comment section which revision sessions you require in the general medicine for upcoming INI CET exam. Thank you very much.